Hospitalizations are at a peak not just for this wave, but for the whole pandemic.
The network's Lali Solache is in the control center with more on this record number.
Hospitalizations for COVID-19 hit a record high Tuesday, passing the previous high set a year ago, and this putting more pressure on healthcare systems that are fighting against staff shortages. As America struggles to manage the COVID-19 crisis, healthcare workers are being pushed to the edge.
A lot of hospital systems simply do not have enough staff because people are out with COVID themselves, diagnosed, forcing to isolate and quarantine themselves.
In many states, some COVID-positive healthcare workers are continuing to work. In line with CDC guidance, state health officials say because of critically low staffing levels at hospitals and nursing homes.
Could have anticipated the depth of the staffing challenge that we find ourselves in right now.
Across the country, more than 145,000 people are currently hospitalized with COVID-19, a new record high, according to data from the Department of Health and Human Services.
This latest surge of Omicron is like nothing we've seen.
Data from the Centers for Disease Control and Prevention show the risk of hospitalizations is 8 times higher for unvaccinated people than it is for fully vaccinated people.
The substantial number of absolute cases is resulting in hospitalization increases across all age groups, including children aged 0 to 4.
This comes as federal officials drive a familiar point, urging the public to get vaccinated or boosted as soon as possible.
The emergence of the Omicron variant again emphasizes the importance of vaccinations and boosters, which decrease the risk of infection, severe disease, and death caused by COVID-19.
And according to the CDC, Omicron has caused 98.3% of coronavirus cases in the U.S. during the last week. In the control center is Lali Solache, South Florida Media Network.